Welcome back to another session of A Day with Your Fertility Specialist. I'm your host, Joanna Damina, for today. It is so lovely to have you here. We really do appreciate every click, every like, every comment, and every share that you encourage and you show to us on our live sessions. So yes, thank you for joining us again today. Today we have a topic that is very interesting. I say this every time, but that's true because every topic is quite interesting. We're talking about sex selection and family balancing. And joining us today is Dr. Deborah Olubi. Welcome on SES, ma'am. Good
Thank you very much.
afternoon. Yes,
Good
ma'am.
afternoon. Thank you very much, Joanna. It's always a pleasure to be here,
Yeah.
and good afternoon, viewers. We're always happy to have you all here.
True, yes. So if you're watching for the first time, like I said, you're welcome. Dr. Deborah is a family physician and the IVF coordinator here at Alps Hospital. So this is a lot within her field, right? Sex selection and family balancing. If you would want to know more about this topic, please stick with us. And if you know somebody that is interested in it, has talked to you about it or has mentioned it at any point, you can share this live session with them so they can join us and learn a lot more. We're here to help you make better choices and more informed decisions concerning your fertility in general. So, Dr. Debbie, sex selection, right? What exactly is it? How is it achieved? What kind of reproductive technologies are used? Because I know it's not something that just happens like that. Yeah, like this name mentions, you're selecting the sex
Yes.
of a child. Yeah. So how does that go about?
Yeah, so like you said, sex selection is just simply selecting the gender or sex of your child before pregnancy happens.
Okay.
So we usually employ assisted reproductive technology, especially IVF, to achieve this aim. So for this to be done, a client would have to have an IVF treatment.
Oh, okay.
So the embryos generated are then sent for pre-implantation genetic testing. That's the DNA of each embryo is tested to determine what gender
Yeah.
they are. And then depending on the gender that the client has selected, is the embryos of that particular gender now that will be transferred back, during an embryo transfer into the womb of the woman for pregnancy to happen.
Okay.
Yes.
So, but how accurate is this in today's age or with these technologies?
Okay, so we have different methods of achieving this aim.
Okay.
But if pre-implantation genetic testing of the embryos is done, then it's almost 100%,
Oh,
about
wow.
99.99.
That's
So that's
interesting.
practically 100%. So it's quite
Yes.
accurate. But having generated the embryo, what that means is if pregnancy happens, it can only be the gender they selected.
Okay.
Yes, so if
Okay.
pregnancy happens, it can only be the gender they selected. So it's very, very accurate.
Okay.
But there are other ways, that we can achieve gender selection, though these ones are not as accurate as when you do pre-implantation genetic testing.
Yes.
So we can sort the sperm based on certain characteristics of the sperm, like the morphology, the way they move, to be able to differentiate them into the male, the sperms carrying the Y chromosome, and the sperms carrying the X chromosome.
Okay.
Yes, though this is not accurate.
Yeah.
So if you are really determined, about choosing a gender for your child, we would prefer that you use pre-implantation genetic testing, which is very, very accurate.
In that you're taking like the DNA, what makes that embryo you're
it's
really
tested.
taking it, and
Yes,
you know that
it's like
this
doing
is-
paternity test to
Oh,
know if an
interesting.
offspring, this is the
Yes.
father. Yes, something
Yes.
similar is done
Oh,
when you
okay.
do the PGT. Something similar is done.
Okay, that's interesting.
Yes.
I know, especially in our society,
Yes.
when I hear of sex selection, I don't know if this is me being biased, but most of the time I feel like it's something related to just the societal thing and more like personal preference, usually
Yes.
maybe with male children and female children,
Children.
trying to balance that. Is there a I don't want to call it a line, but I would say like more of a difference between the medical aspect and then the personal preference for sex selection.
Yeah, so there are lots of reasons why people want to do sex selection. So
Mm-hmm.
there's a medical reason for why people want to do sex selection. In some
Okay.
societies, sex selection are done for medical reason to prevent the transmission of X-linked diseases. There are some diseases
Oh.
that are carried on the X chromosome,
Mm-hmm.
that those abnormalities are only carried on the X chromosome.
Mm-hmm.
And those kind of diseases, that the male gender, they have an XY, one X and a Y
Yeah.
chromosome that makes up the male gender, but females have two XX. So
Okay.
those kind of X-linked diseases, they're usually more prevalent in the males, because once a male inherits that abnormal X gene,
Mm-hmm.
the disease usually manifests. But a female, since you have a chance of inheriting one abnormal X gene and the other X gene could be normal, that compensates. So most times the females are usually carriers. Diseases like hemophilia, Duchenne's muscular dystrophy,
Oh
they're all
wow.
X-linked.
Oh
So
wow.
in some advanced societies, that's where sex selection is done to
Mm-hmm.
avoid the having a child with these X-linked diseases.
Yeah.
But when we look at our own environments, it's more of preference and then the cultural bias. We
True.
know in the African society, unfortunately, somehow more importance is placed on having a male child.
Yeah.
Yes.
Yeah.
So many times in our own societies, sex selection is done for this reason.
Mm-hmm.
People want to maybe have a male child, but sometimes it's also done for family balancing. Family balancing is when people want to have a mix of children
Okay.
in the family.
Okay.
They want to have a mix of children. Maybe they have a lot of male children, they want to have a female child, or they have a lot
Mm-hmm.
of female
Male
children and want
children.
to have
Yeah.
a male child. So
Yeah.
sex selection can be done to balance the family and can be done based on preference,
Mm-hmm.
and it can also be done from a medical point of view to avoid inheriting X-linked disorders, to
Okay.
prevent the
Well,
transmission.
yeah, that's interesting. If you're following along with us, I think you'd find that quite interesting that, there's actually quite valid medical reasons as to why you may want to do sex selection.
Selection,
So if you're
yes.
thinking of it only from a societal point of view, you might also want to think of the medical point of view. Of course, we're looking forward to the best for you and your family. Now, Dr. Debbie, how do you navigate situations where it seems like the couples that come to you for sex selection are getting external pressure for that, and maybe it may not be something that they really want, and it's not really medically something that they've even thought of. It's just more of a, like you said, in our society it's very much preference is placed on the male child, right? And if you have things like that, talk about your in-laws, say, if you've not had a male
Male
child,
child, you've
your
not
family
had
is not
children,
complete like
yeah.
that. How do you deal with clients that have that kind of pressure? Do they sometimes change their mind when you discuss with them? How do you
Okay, so
navigate that?
usually it's a client that comes and says they want to have sex selection done for
Mm-hmm.
them.
Yeah.
So it's not like we are the ones pressuring them.
Yeah,
So a lot
no.
of them is because they've succumbed to whatever pressure it is, maybe from
Yeah.
their family, the society,
Mm.
and they now bring themselves forward to say they want to have
Oh.
sex selection done. So sex selection is not cheap, especially if you're doing the one that is 100%, which is what
Yes,
we
the
advocate for.
pre-implantation. Yeah.
Yes. So for you to present yourself that you want to do it, you must really want to do it.
Mm-hmm.
Yes. So a lot of clients don't change their mind.
Okay.
Yes.
Yeah.
Some might want this, but when they hear of the financial resources involved and all that
Yeah.
is involved, maybe
Yeah.
they see that at the present might not be able to afford it. So that's the only reason people change their mind, mainly based on cost
Oh,
implication.
okay,
Yes.
okay. That's good to know.
Yes.
It would be a bit disturbing if it was because of any other reason. But over here we have just talking about family balancing.
Yeah.
Is it just more of a societal thing, or is there also any medical inclination from that, except from the X-linked disease that you're
Okay.
talking
Yeah.
about? Are there other factors involved in family balancing itself?
Yeah, I think for most people, I think it's more of a societal thing, at least in our environment where we practice. I
Mm,
think it's more of an African thing,
yeah.
because we see more people wanting to balance their families when they just have female children.
Mm.
It's rarely that you see people that have male children coming to say they want to balance
Oh
by
wow.
having a female
Female
child. It
child.
happens, but the
Yeah.
frequency is not as high as people that have female children
Hmm.
and want to balance and have a male child or
Oh,
male
wow.
children. Yes.
Oh.
So I think it's more of a societal thing, an African thing. Though we know that there's always this innate desire for every couple. Most couples want to have both gender.
Yeah.
Yeah. So so for some people, if you can afford it, why not have your heart desire?
your
So
heart desire.
many people, the scenario we see a lot of times is that male children wanting to, I mean, a lot of have female children and want to
Want to
balance
balance with
with
male
male
child.
male
Oh,
children.
okay,
Yeah.
okay. Well, are there other, factors that you would assess as a physician when you're seeing your clients and they want to go in for sex selection?
Okay, so the general assessment, like I mentioned, to have sex selection done, you must have an IVF done.
Yeah.
So the general evaluations that we do for a client having an IVF, all those evaluations must be done for them to be
Okay.
sure that they can, because at the end of the day, they would have to have an embryo transfer. For these embryos that has been genetically tested to be transferred and selected for the gender they want to be transferred back to them. So general physical evaluation to make sure they are healthy, they can carry pregnancy, and all the evaluations we do for even
IVF.
our routine IVF clients
Yeah.
that are not doing sex selection is done for them.
Okay. So it's just like the IVF process. It's
It's
just
just
that
the IVF
there's
process.
an added
Yes. There's a
set of
PGT,
a
exactly.
testing
So
before.
after an IVF, when
the
the embryos
transfer.
are generated, they cannot have a fresh embryo transfer.
Oh, okay.
Yes,
Yeah.
because these embryos must be frozen, sent to the genetic lab for these testings to be done. So they will come back later for a frozen embryo transfer.
Oh, okay,
So that's
okay.
that's the difference.
Okay, that's quite interesting. Sometimes some people might just think, yeah, you just go in the lab and you're just going to test and
it
just
takes-
check,
it
and then
takes-
you go ahead
it
and do
takes
that.
some weeks.
Okay,
yes,
so you
it takes
still need
weeks.
some patience when you're coming along
Exactly,
to want
yes,
to do
yes.
sex selection. But have you seen any long-term impact of sex selection with the family dynamics with clients that you've dealt with in
Yes.
the course of your treatments?
Okay, long-term impacts, not really.
Hmm.
Like I said, most of the sex selection that we see that is quite common is people trying to balance their families.
Yeah.
They have one gender, so the couple, the families are usually much happier.
Happy.
Yes,
Yeah, I can
yes,
imagine.
yes. So they're much happier.
I can imagine how that goes. Yeah. Okay, well, I think those are some of the most important things when it comes to talking about sex selection and family balancing that we have here. But then before we go, I mean, it's still a medical procedure. It's still, a
So maybe
process
I
that
should
is
even
being
talk
done.
more about because people come and say they want to have sex selection. They don't really understand the process involved.
Exactly.
Yes. So when we're doing sex selection, like I mentioned, we do an IVF first and want to generate embryos for them. These embryos are then sent to the genetic lab for the testing, pre-implantation genetic testing to
Yeah.
do. So and you usually want to generate quite a number of embryos. That makes the process more cost effective.
Oh, okay.
And then not just any kind of embryos can be tested. Usually we want these embryos to be at the highest grade. So that's why sometimes, for a couple to be able to generate this number of embryos that we feel is adequate,
Yeah.
you might have to have more than one IVF stimulation.
Oh, wow.
Yes, that's what we explain to couples. You might have to have
Okay.
more than one IVF stimulation because after an IVF egg retrieval,
Mm-hmm.
the number of eggs gotten is fertilized, then they're allowed to develop. If these embryos do not develop to the stage at which they can be tested, those ones cannot be tested.
And
So
it's not every egg that is fertilized. That will
definitely not every
develop,
egg is
yeah.
fertilized to even talk of getting to the
Yeah,
to
embryos
embryos
and-
and then the
yeah.
stage we want.
Oh,
So you
wow.
might need to have multiple IVF stimulations to be able to get a cohort of embryos for
Yeah.
this testing to be done.
Okay.
So it can be, it takes, like I said, it's a process, it takes weeks. So and then after the required number of embryos are gotten, then they are sent for the genetic testing. That takes a few weeks too.
Yeah.
So it's after this process has been completed, and then they tell us, oh, this embryo labeled A is this gender, this is
Okay.
this gender. Then we now prepare the client for
Okay,
a frozen embryo
I have a bit of
transfer.
let's say a funny question. But how do you keep track of the embryos?
They are properly labeled.
Oh,
Yeah,
okay,
so
okay.
there are no mistakes.
Okay, that's
Every embryo is
interesting.
properly labeled.
That's nice. But I mean, like I said, it's still a medical procedure and it's still IVF. Are there risks associated with sex selection itself, or is it more of an IVF thing in general? The medical risks
Okay,
are
so
associated.
IVF in general, their risk is a surgical procedure,
Okay.
though it's minimally invasive. So as with any surgical procedure, there are some risks associated, but in the hands of experienced personnel,
Yeah.
these risks are brought to a minimal. So the normal risk associated with minimally invasive surgeries
Okay.
could apply. And then, with the embryos, these embryos have to be frozen. So some of these embryos, in the course of all this manipulation, some might not survive.
Oh, wow.
Yes, so
Okay.
that's the risk as related to
To
the embryos. And
embryos.
that's why we want to generate a large number, so that even if some do not survive the process, you still have enough,
Yeah.
to pick from at the end of the day.
Okay, okay. Well, that's interesting. Like I said, it's always very interesting coming on here and hearing your thoughts. I hope that this has given you a bit of a better idea about sex selection and family balancing. It's not just something that you walk in and just do. It takes time and it's a
Yeah.
process.
Yeah.
But is there anything else that you think you would want to tell our viewers that are watching out there about sex selection in general and
Okay.
family balancing?
Yeah, so I think, like I said, it's every human being wants to have both gender. At least most
Yeah.